Hi, Debbie. Hi, Elise.
Hi. Hi. So I'm Debbie. I'm a nurse practitioner.
Cam.
Okay. Yes, I'm Cam. I am a PA and am so excited about this weight loss program that we're doing.
Awesome. And then I'm Elise, also nurse practitioner like Debbie. And so we all work for Leanne Scott and we all love her. And we're in functional medicine. And this is just an extra thing that we're offering to our patients recently about how they can achieve healthy weight, but more importantly, help improve their quality of life and prevent disease in the future. So, sorry, forgot to introduce ourselves. So, Debbie, do you want to tell us what semaglutide is?
Semaglutide is a GLP-1 agonist that has been used to treat type 2 diabetes. It also was used originally to treat Alzheimer's patients, but didn't work as well for those patients because they were losing weight. We don't want Alzheimer's patients losing weight. So then type 2 diabetes patients continued to lose weight on this, and about a year ago is FDA approved for weight loss. So it's the new weight loss medication. It is an injection that you give once a week to yourself, or you can go to the pharmacy and they'll give it to you for you. But it's just a very small needle done subcutaneously.
Awesome. And then I think the big question everyone would always have is what kind of side effects does it have, and really how does it work?
You want me to do that?
Sure, Cam.
Okay. So a lot of people don't have major side effects with semaglutide, but one of the main ones that we'll see is they'll have nausea. And the reason why that happens is because it will slow down how fast the stomach empties your food. It actually slows down all gut motility. So because of that, people will feel a little nauseous. We can easily fix that with Zofran. Literally works within like a minute or two. And then as time goes on, as you're on this medicine, the nausea actually decreases. So that's a good thing. But because it slows down the emptying of your stomach and the gut, just all of the gut motility, some people will also feel like they get a little constipated. So we just make sure you're drinking plenty of water. It will increase your thirst. If it doesn't, then you need to be drinking a lot of water. And then we also just make sure that you have magnesium in case you just need a little extra help on the back side of the gut issues.
Nice. And then I think another question that we got was about, how much weight can someone expect to lose over what period of time? I know it's so variable, but I mean, in our experience, what would y'all say is a typical weight loss schedule for people?
Well, that is really hard to say. It's going to be very individualized as far as what their goals are. But there was a study done that showed 14.9% of body weight loss on using semaglutide.
And how long did that take? I don't remember exactly. Was it a year?
I believe that study was 20 weeks.
Oh, okay. I was off a little bit.
Well, I think the Wegovy, when they did it with the actual Wegovy, which is the higher dose, like when they get you up to that high dose, and they did that after 16 weeks, that was 68 weeks. And people lost up to 18% of their body weight. But everybody in that study had a BMI greater than 30, and the mean or the median BMI, whatever number that was 38. So those people had significant more weight to lose.
Yeah.
And many of them did not have good eating habits to start with, so they had a lot of room for improvement.
Yeah. And then what are the absolute no's? Who cannot do this?
Well, you can't use it if you have a history of thyroid cancer, if you have type 1 diabetes, if you have pancreatitis, which you would know because you'd be very sick with pancreatitis.
Well, we would hope, right?
Yes.
Yes.
If you're breastfeeding or if you're planning to become pregnant in the next 3 months, then we say you're probably not a good candidate for this.
Yeah. So how long, I think we confirmed this, but we recommend you be off the medication for 2 months prior to anyone trying to conceive. So that was kind of one of the hard no's that we found out recently too.
Right.
And then, so like how in our clinic, I mean, I know all these answers, right? I'm just, getting the people talking. So how is our clinic doing it? How many appointments, what's included, all of that fun stuff.
You want me to answer that?
Sure.
Okay,
I'm just playing facilitator, guys.
Thank you. Thank you. So we're doing a 3-month program. So it's 90 days. We see you at the beginning of the program, and then we see you at the end. And you will have 3 health coach visits. Those are virtual. I think it's 1 every month, but I have been telling my patients, if you need to chat with them sooner than you can, but you have 3 of those. And then I said 2 appointments. We also do a body composition measurement with a scale that we have here. And you get a booklet that gives you all the information. And that is about 3 months worth of medicine.
Yeah. And that's important because it does include the full 3 months of medication. And so, I mean, that's also included in the price, which I know a lot of people ask me about. So, yeah.
But in addition to that, Elise, we are, as we've had patients going through this, some people have needed to go up a little faster than others. And so there is, I mean, we'll discuss that at your visit. But if you are in that, if you are that patient that needs a little bit higher dose, then the 3 months, you might need a little bit more medicine than the 3 months, right?
Yeah, and that's one of the things we were talking about. I haven't seen it yet, but it is possible that someone could have to go up on the dose to get the effect that we're after. And we're partnering with a pharmacy that's local over here called Las Colinas Pharmacy, and they're doing it for us. And it's semaglutide, which is the medication, and then it has B6 in it as well, which helps with the nausea. But so we work with them. So if anyone needed to have more medication, we have a good relationship with them. It'd be easy to do. And that's where people pick up their prescription anyways. And they're also the ones who, if you're very scared of needles, will inject it for you. I think they charge
$10.
I think it's $10, but very, very low cost injection if you absolutely can't do it yourself. But when you pick up the prescription, you can ask plenty of questions about how to give it. And then there's also some videos that we have that show you step by step. So it's not super hard, I promise. Yeah, it's basically the size of the needle of a little allergy shot or an insulin syringe, if anyone's ever seen those. So it's not bad at all. And then, any other questions coming through? Okay. What makes it, I'm sorry, I'm not used to looking at the questions. What makes semaglutide different from other medical weight loss programs? Anyone want to take this one?
I can take this one. So for one thing, it's not a stimulant. So it's not going to be bad for your heart to use this medication. And since it's used to treat type 2 diabetes, it also helps with insulin resistance. And a lot of our patients who have some weight to lose may have some insulin resistance as well. So it would help with that too. Also, it's done, going through our office. We're here for support, and it's done using health coaches to try to change lifestyle and change some of those triggers that may have bothered people in the past and caused some of the weight gain.
Yeah. And then one of the questions was, so Rybelsus instead of the shot. Rybelsus is the brand name of the oral form of this medication. And it just came out not too long ago. And in my experience and from what I have read, we don't use the pill version because there are some clinics that we're familiar with who are doing it orally and they're not seeing the same results in terms of weight loss. So that might change in the future if there's better dosing orally that's found, or maybe a little tweak to how they're making it. But we do the injections because, one, it's been around longer and it has more evidence behind it. It's better studied. We understand it better. So there's less likelihood of, new things popping up we aren't expecting. But the bigger thing is we've really seen across clinics that are doing this better weight loss with the injection versus the oral. And then another question was, do you follow a certain food plan? So
Yeah, I can answer that. So we recommend a few things. One of the important things regarding food with this is making sure that you're getting enough protein every day. And so we calculate your weight, how many grams of protein that you need. I have been recommending a lower carb diet, and so I'm recommending between 50 and 100 grams of carbs and kind of stay on the lower side. But really, that's really specialized per patient how I decide to do that. And then recommend that you do 150 minutes of exercise a week. So, and you can walk. You don't have to be in the gym. You can walk 30 minutes 5 days a week. And then what else? Food. It's mostly the protein and the carbs. Really, the semaglutide helps with cravings so much that I have found people have said they've lost their taste for alcohol. They've lost their cravings for sugar. It doesn't happen for everybody, but just eating a well-balanced diet with good foods, the perimeter of the grocery store, with enough protein and a lower carbs than what most Americans eat on a daily basis.
Yeah. So basically healthy eating in general with exercise as well. So next question, what happens after you stop taking the medication, specifically to insulin resistance?
So the hope is that with the medication, the weight loss that will come from that will significantly impact the insulin resistance. And so it should be less. However, if diet and exercise doesn't change during the course of those 12 weeks, and you go back to the same diet and maybe lack of exercise from before that, then insulin resistance may return.
Yeah. So you basically have to stay consistent with the lifestyle changes afterwards, and you should be able to maintain whatever you've achieved with the medication. And then I know that, Cam, you've probably had more experience in this with the health coaches. So what are those visits like for the patients? What do they talk about, and what are they focused on?
The health coaches, they're really, really good. They're doing this every single day, working with our different clinics all over the United States. I have found that a lot of what I've said is what they will say to you in those meetings, but you have this, it's kind of one-on-one. I think there were 4 of us in the meeting that I did with them. You can ask really specific questions. And I've been recommending that we do our health coach visit, like maybe week 2 of starting the medicine. So you have some questions, because I'm able to give that information, at least the initial information up front. But they are talking about diet. They're talking about exercise, drinking water, how to treat constipation if it shows up. But they also have other tweaks or other supplements that they will sometimes suggest that they've seen work in other patients as they're doing the health coaching. Did that answer the question? I'm horrible at this stuff.
Yeah, they just have a lot of experience in dealing with patients going through this program. So they're really good at answering. Not that we can't, but they're just like that extra resource for the nutrition education. Is this normal? What tweaks can I make to help improve my outcomes? Really the best way is they're just like your own coach. So they kind of help encourage you along the way and tweak it to where it's more specific to you.
Yeah.
Yeah. And they're really cool. I like them. We met them last week at a conference, and they're both really sweet and really knowledgeable. So they've been great for our patients that we've had so far. And then What if someone needs to lose a considerable amount of weight? Obviously, that's not happening in just 90 days. So I guess how long can people do the program? How does the next step work after the 90 days?
So this is where it's going to be very, very individualized, of course, just like all of the services that we offer here and all of the care that we offer our patients. This is going to be case by case, very individualized to each patient. We are going to offer a month-to-month option for after the 12 weeks. And so for some patients that they might still need that, and others may not need that at all. So going month to month is definitely an option. We also may take a break for some patients, take a couple weeks off, and then restart the medication. So it'll be very individualized.
Yeah, because sometimes people do reach a little bit of a plateau after being on it for a few months. And so we might actually go down on the dose, which seems counterproductive, but it kind of just decreases the exposure to that medication. So when we go back up, we see more of that initial response with the weight loss. So there's ways that we tweak it every few months as needed just to help people reach their ultimate goals. And I mean, the reason I really like it is I used it previously for diabetic patients when I worked in a diabetic clinic, and that's who it was originally kind of FDA approved for. And it really does help reduce insulin resistance, but that doesn't just stop there. It helps reduce cholesterol, which reduces heart disease risk. It helps reduce diabetes risk. And just being at a healthy weight reduces your risk of literally every major disease. And so that to us is more why we're offering it. It's not just about fitting into your skinny jeans, although that's great. It is about reducing those metabolic diseases that are so prevalent so people can live better longer, which is one of our ultimate goals here.
Yeah.
So how does this drug affect your blood glucose? I currently wear a continuous glucose monitor and have to manage my blood sugar due to hypothyroid. So, I mean, I can answer if you want.
Yeah, you answer this
Okay.
time.
It does not lead to low blood sugars like other medications can. That's the interesting part about it. It is for diabetic patients. It's how we got FDA approval. But in patients who don't have high blood sugars, it does not cause hypoglycemia either. So if you're prone to having low blood sugar episodes, I mean, I am, so I know how terrible that feels. It should not drop your blood sugar below your norm if it's already on the low side. That's why it's a pretty cool drug, because it doesn't do that in people that don't need it. So, I mean, you'd obviously have to continue to monitor your blood sugar, because there could be that, rare case, rare patient where something like that happens. But in general, it should not drop your blood sugar if it's already normal. And I haven't seen that in any patient. I don't know if y'all have had any blood sugar issues that you've seen, but I haven't heard of it from our other providers that do it, and I haven't experienced it myself.
I haven't seen any.
Yeah. No, I haven't seen that either.
Yeah.
But everybody's different. And so that's why that's why we are so, like, we keep saying how individualized this program is that everybody is different. And so where one person, has one symptom, it's just individualized.
Yeah.
See, I'm horrible.
So much to say, Cam. Can't get it all out. So many weight loss drugs can affect your heart. Primarily stimulants is what I'm guessing this question is about. Does this have any side effects if I have a heart condition?
So I think, as we've said, this is going to be on a case-by-case basis. We would want to discuss the heart condition that you have a little more before making that decision. But I can say in general, no, this does not have bad side effects on the heart as a stimulant weight loss medication would.
Yeah. And, in discussing options with my patients, I think a lot of people have tried those stimulants like phentermine. Everyone remembers fen-phen from the 80s and 90s and how it really caused some heart issues. So I think that's a question I get a lot when we're discussing weight loss measures is this going to affect my heart? And because it's not a stimulant, just like Debbie said, I haven't seen it. It is not a known side effect. And it's basically because it's not a stimulant. So it doesn't raise your blood pressure. It doesn't raise your heart rate or anything like that. And if anything, it reduces your risk of heart disease by reducing insulin resistance, reducing your blood sugar, which can reduce your cholesterol levels. So, ideally it helps, not hurts.
True.
We talk about the labs, which labs specifically?
Oh yeah, what labs? That's a good question. What labs are we checking at the beginning and the end of the 90 days?
We are doing a insulin resistance score, a complete blood count, a complete metabolic panel, a hemoglobin A1C, which is a 3-month blood sugar average, and we are looking at your cholesterol.
Yeah. So ideally everything gets better.
Yes, that is our hope, for sure.
That is our hope, yes.
I'm really excited about this medicine. It's pretty cool.
I know, Cam, you're like a little champion cheerleader for it.
Yep. I've been wanting to use this for a long time, but until you get FDA approval, you have to just you just can't do it. And now that it's been officially approved, I think it was approved last summer, we're able to use it. So it's cool.
Yeah, it is a really good option for people. So in y'all's experience, anything else that you want to add specifically that you've seen or any other positives?
I mean, besides just the weight loss that people are seeing, and getting rid of the cravings, and I'm hoping that that can be kind of a reset for people where they realize that there is a different way to do, day-to-day life with eating and drinking and exercise. It's just such a cool thing that we can do. And it doesn't have all the side effects of the other weight loss medicines that have been out there before. It's really the only one that has showed a large amount of, or a significant amount of weight loss over a long period of time that hasn't just come right back after you stop the medicine. It's something that that we can maintain.
Yeah.
And a lot of patients ask too if they can continue their exercise regimen that they enjoy doing, and if they can do the diet program that maybe has worked for them in the past. And yes, you can do those things in conjunction with using this medication.
Yeah.
Yeah, it's going to help those things, I think.
Right.
Yeah. And then last question is, what about if someone is thin on the outside but has bad numbers? Should they do this or something else?
I think we'd have to see the numbers.
Yeah, I was gonna
I think
say,
we'd have to see
that's
what
tricky.
numbers,
what
the numbers are, and definitely, put them on the scale and take a look at body fat and muscle mass and see exactly, know a little more about what's going on with this patient. But I wouldn't rule them out just based upon that information. So they potentially may be a candidate for this, especially if they're having some insulin resistance. This might be the best program for them.
Yeah, I agree. I was going to say I have patients that I will consider it for who have polycystic ovaries because they have a lot of insulin resistance and they don't always have excess weight necessarily, but their insulin resistance is up, their blood sugar's up, their cholesterol's up, and it can just help with that internal regulation of insulin so well that, again, it's not about losing a significant amount of weight, it's just about improving their health overall. So the dosage is not necessarily different in those cases. So, yeah. But any last minute thoughts? All right. Thank you everyone for jumping on. We appreciate it. Yeah.
Thank you.
And if y'all have any future topics that you want to talk on, like as a patient or someone listening in, just leave us a comment or send us a message to Leanne Scott MD, and we'll do another one of these soon.
Oh, yay. Can't wait.
Oh, yeah, I know.
Great.
All right. Have a good day,
Okay.
everyone.
Thank
Okay,
you.
bye.